All right, so let's demonstrate how to restore sacral float using a medicine ball. You're going to use the same medicine ball you likely already have for your spinal medicine ball. And then we suggest using a pad under your back. I've got a 6-inch riser block here because that helps elevate my spine so that I feel all the weight through the ball and don't have a lot of stress through my back. So we set up like this. I'm going to bridge my hips up, place the ball under my right SI joint, and then set my weight down on there. I'm on the right side of the SI joint, and I can locate that by moving back and forth. I'll sort of feel a bump there, and if I move up and down, I can get sort of the center of the joint. And then we're sort of placing our contact here just to see how it feels. If it gets your attention and feels a little bit uncomfortable, that is what we're looking for. It shouldn't be painful, but it should be uncomfortable. And we're gonna wait for a minute or two on this spot and see if it softens up. And this might be all you do initially, just to sit here. But once that spot loosens up, maybe over the course of a couple of days or a week or so, we can start introducing other movements. And so first movement we're gonna do is dropping this right leg out. By dropping that leg out, that gaps open the front of your SI joint and loads that front anterior SI ligament. So once you're loading that ligament, you can move your hips up or down on the ball to get different parts of it. So the ligament, or the joint rather, is about 1.5 inches long, and so you might get very different pressure on the joint on the top or on the bottom, and you might find that a different amount of leg out allows you to locate the stretch in a certain way. So that's how we treat the front side of the joint. The back side of the joint, we're going to drop our knee in and across. I might have to move my left leg out so I don't feel like I'm gonna fall off the ball, but I'm driving my leg in so I open the back side of the joint. So we think about the book opening in the back, and then I can locate the ball up or down, different places on the joint to get a better stretch on there. And then again, we wanna stay on that point for a minute or two until we feel that elastic change happen. And then hold until we get the plastic change. So the plastic change takes 2 or 3 minutes. So you want to sit on that point. Now if it gets too sore, the soreness increases over time, you're done for the day and come back to it another time. We also want to do the other side. So we can repeat that on the other side. You'll do all the same movements, but generally one side is going to be pretty spicy and the other side will be not that interesting. So the side that isn't that interesting, you do want to scan through and do all the movements and kind of see if you can find anything that needs treatment. If not, don't worry about it. And the last thing we do is position the ball right over the midline of the sacrum, and we're just allowing both SI joints to sort of float open at the same time. So we're opening both sides of the book at the same time. We can move the ball up and down a little bit. We are not going to do your low back though, so we're not moving the ball so it's above your belt line. So that is going to put extra pressure on your low back. We just want to avoid that for now. And once you felt everything soften up, it should help over the course of a week or 2 or 3. And hope it works for you to regain that sacral float.